The other fact is, which I don't know if people really got, was in that article, it also said, in quotations, other pills were found around Matthew Perry. What are those pills? I'm Flindt Andersen, founder of Pain, Parents and Addicts in Need. I've been in recovery since 2001, and there isn't much I don't know about recovery. And my mission is to constantly tell the truth about addiction, to make the realities of addiction, recovery, and drug culture known, and to drive awareness and advocate change that ultimately saves lives.
And I'm Jason LaChance, a certified recovery coach with a passion for speaking with others and sharing their knowledge to help others seek recovery and maintain long-term sobriety. And this is the Don't Hide the Scars podcast, presented by Pain, Parents and Addicts in Need. Boy, Mr. Andersen.
Mr. LaChance.
It is almost Christmas. How did it get here so quickly?
I know it.
The days just keep ticking through, I tell you what. But it's been a heck of a year for us here at Pain, that is for sure.
Yep.
And kind of closing out the year, releasing this episode a little bit early because we know people will be enjoying family time for Christmas, hopefully, on our normal release date. So we push this one forward, and it's timely because more has come to light on Matthew Perry's passing after the toxicology report and the coroner's report. And I had several people reach out like, hey, tell me what ketamine is. And I went, I don't know, and I'm not going to pretend I do, but I'll get you an answer. That's really prompting this conversation for sure.
Yeah. Ketamine, first of all, it's been a very up and down year. I mean, just as far as the fentanyl epidemic in general, there have been some very good advancements, so to speak, in fighting the epidemic. And then there have been some real stalemates, in dealing with Sacramento and just municipalities in general. We're still in the middle of the crisis. It seems to be getting worse. And I will say this on a political note, the war in the Middle East has definitely put a damper on, I don't even know if that's the right word, but put a damper on, it seems like it's put a damper on all the advancements we were making in the fentanyl epidemic. And that bothers me. Yeah. It bothers me a great deal. And, but 2024 is right around the corner, and hopefully we can continue to make the noise and get the changes needed.
Yeah. And you're right. It really has, as being a part of, and you being the leader here and us, trying to make that noise and get this more in the news. And not that we're taking away from what is going on, as if we're fine with that's the state of the world in any regard.
Right.
It's far from it. But it's tough, and it's tough when the passing of someone, in which there's so many that aren't celebrities, but that's will kind of at least kick it back in a little bit into the public eye, because,
right.
We're expecting another high of overdose death rates in our country, in the world. It is now our number one killer.
It is. And addiction deaths, addiction in general rises during these months.
Yeah.
It can be very difficult for those in recovery during the holiday season. So relapse rates tend to rise during this time of the year. But yeah, it's when someone passes like a Matthew Perry, there's, and again, I don't know if controversy is the right word.
Sure.
But there is some controversy surrounding this, and without me saying, I told you so, I kind of told you so.
Yeah, we speculated, for those that maybe missed it, on a past episode, and most certainly not adding any shame or anything like that of any nature, because that's far from our minds and hearts when it comes to addiction, and fortunately those that we lose. But we very much stated things that the toxicology report and coroner's report have confirmed and aligned.
Yeah. 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 And again, just so I'm not giving everybody the, my personal view of what ketamine is, and I've got it right here. Ketamine is a dissociative anesthetic that has some hallucinogenic effects. It distorts perceptions of sight and sound and makes the user feel disconnected and not in control. It is an injectable, short-acting anesthetic to use in humans and animals. So we've always known that ketamine was basically used in animals. Right. If ketamine was used on a human being years ago, I didn't hear about it. And I'm sure it was. But it's a particularly strong narcotic, again, addictive as all hell. And it actually induces a state of sedation to where you almost feel like you're leaving your body. So I mean, for the person that's using it under normal circumstances, they're probably going, "Oh God, this is the greatest thing in sliced bread," But and this, prior to his passing, when I said he didn't look good, his weight had increased instead of decreased. You usually lose a little weight while you're in recovery, early recovery. Your skin color comes back. Your eyes aren't darting from one side to the other. Your speech isn't impaired. Not that he had this, massively impaired speech, but when you've been in recovery as long as I have, and in this world, we know that there was just something not right with all of this. And again, sorry, but I did not like the way he was promoting his book. I did not like the fact that he was out there telling people it cost $9 million for him that he spent on treatment centers, because that has a twofold effect.
Sure.
It's like people without money are going, "Oh, poor you."
Right.
Kind of a thing.
Right.
And it leaves a bad taste in people's mouths for the treatment center. Well, you guys just kept taking him in and taking him in and taking him in. And so with that, he's got a foundation. And according to what I have read in the last week, his family wants to continue the foundation. They're asking for all this money, but what are they going to do with the money? No. How does one, now that Matthew Perry perished the way he did, because he was getting, from what I understand and what I've read, he was getting injections of ketamine via his doctor. But the amount of ketamine that was being given to him by his physician was not nearly enough to cause the overdose. But he was also taking buprenorphine. And we need to explain that. Buprenorphine is Suboxone.
Yes.
It is a medication that is opiate-based. We all know, especially as recovering addicts, that buprenorphine is extremely difficult to get off of once you become dependent on that drug. And because it has a longer life than a normal opioid.
Does it have a very big similarity then to a methadone?
Correct.
Okay.
Correct. But it's different though. It's different, but for the sake of this conversation, similarity. Okay. So as I kept reading this and looking at it, and I'm picturing him sitting in a jacuzzi. Mm-hmm. Now, look, we all know that if you're drunk out of your head and sitting in a jacuzzi, you could easily drown.
Yeah.
Okay. If you're taking an opioid medication of some kind, you can easily drown. But it depends on how much you're taking.
Right.
See, an example would be Suboxone comes in a different variety of dosages. So if he were taking, let's say, 2 milligrams of Suboxone, mixed with ketamine, that could have possibly caused the cardiac arrest. It could have caused him to just pass out and go under. But I'm guessing now. Mm-hmm. But I would imagine he was on more than 2 milligrams of buprenorphine.
Right. Yeah, I don't think there was a number, but I wanted
There
to
wasn't,
make sure
yeah.
I had some of the stories that were going off of Dr. Peter Grinspoon, MD, a primary care physician at Massachusetts General Hospital, instructor at Harvard Medical School, and author of Free Refills, A Doctor Confronts His Addiction. He is quoted as saying, Mr. Perry had a ketamine infusion a week and a half before he died, but ketamine, as you said, has a short half-life, a few hours. So that wouldn't have been enough ketamine
Correct.
in his system to cause it. It appears that he was supplementing this ketamine treatment on the side, and thus the Suboxone, buprenorphine, the word I can't say.
Buprenorphine.
In addition to what they said, he had some heart issues and other things.
Well, and then, right.
What you've talked about, like, hey, this stuff, you've been grinding it out. Like this, there is no inconsequential use to it.
None. Right. The other fact is, which I don't know if people really got, was in that article, it also said, in quotations, other pills were found around Matthew Perry. What are those pills?
Right.
I don't know. I'm not going to speculate.
Right.
Right. But I wouldn't assume that that there were heart pills sitting out around him. Okay. Right. I would assume, again, that it was some sort of narcotic or benzo. I don't know. But then they would have reported a benzodiazepine in his system. So I don't know what those other pills were. Again, I don't know if there was alcohol involved. Did he?
Right.
They didn't say if there was alcohol involved.
Right.
But regardless, I'm just going to say it. He was bullshitting everybody.
Yeah. Well, and that's another article we pulled from the Daily Mail, where a close friend who remained anonymous claims that he was still struggling, and the reality was much different than the picture that he was painting. And this anonymous friend goes on to say he lied to everyone about being clean. He never was. It is very sad. You know, the biggest lie he told was probably to himself, this individual disclosed.
Right.
So,
right. You know, and again, the sad fact in all of this. Well, before I say that, you know, and so it's going to bother me for a bit here until somebody can give me, a better answer. What are they going to do with his foundation?
Sure.
You know, because this is the way that foundation, the minute he started it. Look, you have to be very careful in starting a foundation if you're still in active addiction.
Yeah.
You know, and the fact of the matter remains is that he was still in active addiction. Now, has it been the entire time? I don't know.
Yeah.
I simply don't know.
Yeah. Was this the slip up relapse?
Right. I mean, what was it? And how does the foundation now fix that?
Mm-hmm.
Because is somebody going to give money to a foundation that the founder lied?
Mm-hmm.
I mean, I don't know.
Well, we went down that totally different scenario with Lance Armstrong and the Live Strong Foundation, and you know, which it's unfortunate because maybe Matthew Perry's foundation, much like Live Strong, helping a lot of people.
You bet.
So
you bet. And again, this really is not a slight to Matthew Perry.
No,
I understand addicts. I am one. I understand more than most, even where he was at that time. You know, we feel helpless.
Mm-hmm.
So, and that's the power of the addiction. You know, however the depression happens, however it happens, you know, it happens for different reasons. You know, we get caught up like the squirrel, you know, or the hamster in the cage, that we just can't get out of it. And so we reach for something. Sometimes there's just no explanation for it, you know, because people are going to go, why did he relapse? Why this? Why? I don't know. You know, there's times when I do know and times when I don't. And this is when I don't. Yeah. Because it also seemed like he was, when I would watch him speak, and there was just something secretive about him.
Sure.
Again, I can't put my thumb on it directly, but to me, there was just something secretive going on. And that's what we do as addicts, man.
New Perceptions North, the premier drug and alcohol treatment and recovery center in Central California. A full continuum of medically supervised top quality care with programs for detox and patient residential treatment with dual diagnosis, intensive outpatient treatment, sober living support groups, and more. New Perceptions North provides adult men and women with the highest caliber of professional health care, treating each client with compassion and respect in a safe, comfortable environment to begin the process of recovery to proudly create and sustain a life without addiction. Call 559-978-1507 or visit newperceptionsnorth.com.
Okay.
Well, that's what I was going to say is I think it's just, you've had, so much more long-term sobriety than I, and it's not a competition. I'm saying that to give people relevance of how much additional knowledge, and plus you working in the field far longer than I, and with people directly and families and all that experience there is like, when you were telling me that, I was kind of like, oh, come on, Flindt. And then I kind of paid a little more attention and caught some of the snippets of interviews, and I was like, oh, crap. I think you're right.
Rotten in the state of Denmark.
Right.
Mm-hmm.
And I think, and you're right. My point of that is, you can you get to a point of sniffing it out, and you have a pretty quick sniffer with it.
I got a pretty quick sniffer on this one. You bet. So yeah, it's, and so I have to think about the number of people. Maybe people don't give a shit anymore. I don't know. It seems the world doesn't give a shit about anything. But maybe people don't care that he lied. I don't know.
Yeah.
I don't know.
I don't know. We're in such a
screwed up.
As is already.
Right.
With a lot of contradictions. And I mean, my perspective is kind of, please, whatever funds you have, keep helping people. But you might have a PR campaign here that's pretty uphill and how to.
You bet.
To do it, or
you bet. And so again, that just goes to prove my point on long-term harm reduction. To where I say short-term harm reduction keeps us alive. Long-term harm reduction keeps us trapped.
Yeah.
And Matthew Perry was trapped.
Yeah.
Because you cannot say, I don't give a shit what anybody says. You cannot say, I'm clean and sober when you're not.
Yeah.
I don't care how many non-addicts out there say that. Okay. I'm sorry, you're not. Clean and sober means just that. Abstinence. Period. Yep. Enough of this beating around the bush, going around this corner. Let's justify this. Let's justify that. Mm-hmm. No. The truth is the truth. And the non-truth is the non-truth.
Yeah. Well, it's like people that'll say, and I strongly disagree with this, slip-ups and relapses is part of recovery. No, it's not. It's part of your addiction. It's
part of your addiction.
Your recovery is your recovery.
Right. And, and it's interesting you say that, because years ago, I used to agree with that. That it was, but I think I was looking at it from a different standpoint.
Sure.
But today, no, it's not a part of recovery because it doesn't have to be. It simply doesn't have to be.
How many numerous people do we know that never had a slip up or relapse?
I know them.
Yeah.
You know them.
Yeah.
Right. I mean, recovery is difficult. We all know this. So again, we're not saying that a recovery, that a slip up or a relapse, we're going to crucify the person. Yeah. That's not what we're saying. We need to make that real clear to people, because like I said, addiction does not define who a person is. But if you are working that program, and if you are doing what you are supposed to be doing, those chances of a slip up or a relapse, they can be far from the equation.
Yeah. Yeah.
And we've got people to prove it.
Yeah.
So again, this whole, long-term harm reduction thing is, in my opinion, is bullshit.
I think especially for, let me and challenge me on this. It's much harder for the individual that is out there on the streets. But I think when you're the guy that you spent $9 million, like, come on. Like,
Right.
I don't like it either for the person on the streets. I wish that we had, that funds were used a little more wisely to go, you know, my guy is Arthur there where I got that when he's sober, buy him something to eat, something to drink. When he's high, try to talk him down if he's scaring people.
Right.
Primarily he's methamphetamine that I can tell. Obviously not fentanyl because he's present.
Right.
As president you can be. Yeah. But damn, if there was money to get Arthur help, like actual, and I knew it, then I would be like, hey, let's go get you help. Unfortunately, there isn't.
Right.
So there are those people that we would love to have the $2 billion lotto ticket to be able to help. But like when you have the access to the services, I find that there is no excuse whatsoever other than somebody trying to continue to get funds out of you.
Right. Now, there's another side to that. When somebody has money, I mean, again, we're talking about celebrities, a Lindsay Lohan, okay? The best thing that could have ever happened to either Lindsay Lohan or Matthew Perry was that they were broke.
Right.
That could have been, and by the way, I'm not saying that everybody, is not supposed to have money.
Right.
That's not what I'm saying. But when you have that kind of money that you can afford to go into these, and by the way, I could almost guarantee you these people are going to treatment centers that are taking advantage of them because they are charging them $50,000 to $75,000 a month to go there. To those people, it's pocket change. And so when you've got that kind of up your ass money, you go as many times as you want.
Yeah.
Because it's not a big deal. Their intentions, I'm sure, were good when they went in. Here's the 50,000. Yeah, I'm going to get clean and sober. But the minute they got out, again, they probably weren't working a recovery program to the fullest. I'm not saying they weren't working one at all, but to the fullest. Now they're at a party because they still think they can go. They have that drink, they have that hit, they have that bump, whatever it is. Okay, next thing you know, they're back on track again. Okay. But now all you got to do is reach in their pocket and pull out another 50,000.
Yeah.
And off they go to another treatment center, and that treatment center is more than willing to bring them in.
Yeah. Yeah.
So when you get to the point where I'm just saying money is not an evil thing, in my opinion, or it doesn't have to be an evil thing. But it's I think when you have that kind of money, it helps assist you in your active using.
Yeah.
That's just my personal opinion.
Yeah. Well, and how do I do? I guess I can just name drop. I literally had a conversation with Charlie Sheen about the Tiger Blood era. And I said, as a person, looking him in his face, it was sad to me while the news was whatever. And I saw a man that was, all of his bullshit was being co-signed because you could write checks. And he went, yeah, spot on. Yeah, I was surrounded by a bunch of people. And he goes, and they're all fired now.
Oh, yeah. But
that's an example of what it is, whereas opposed to the gentleman out on the streets that it's their addiction is a whole different game of getting their substance.
And that's why I've talked about for years, this addiction and the recovery process of people have to almost be split into twos. It's the people that, as I say it, it's the people with insurance and PPO insurance and the great insurance policies, and it's the people that don't have insurance or have a Medi-Cal or government-assisted insurance of some kind. We have to be able to provide services for all those people. But I'm sorry, the person that's on the street is not going to be able to go to Betty Ford Center.
Yeah.
and the person with all that money certainly isn't going to go to, a government treatment facility somewhere, where they're eating, beans and franks every night for dinner. I'm sorry, it's not going to work that way.
Yeah.
So I just wish some of these treatment facilities would just, I don't know. I mean, this I didn't want this to be about treatment centers, but I wish they would just kind of be in the middle and get rid of all the little extra horse shit. That they have, like I talk about, I've never seen a horse get somebody sober, right? Horseback riding, go fuck yourself. Okay. I mean, as they're horseback riding and sitting by the beach, the parents are home going, what?
Yeah.
I mean, really?
Yeah.
I mean, do people really think that's going to help?
Yeah.
They've caused grief and havoc for months, if not years, but now they're vacationing. Anyway, that's another topic for another show.
Yeah. Yeah, another show.
Yeah.
We'll leave it there.
We'll leave it there.
I do think, being that we are releasing this episode early, normally we release on Mondays, but we're dropping this on the Friday just before Christmas. I think it would be good to some of those sober tips. You brought it up. This is a really tough time of year for people, especially those new to it. We've got a mutual buddy of ours who just hit over a year and was asking, hey, what did you recommend? I'm like, are you staying connected? Yep. And he works in treatment now, and he'll actually be
at the
facility, not his recovery.
Too soon.
Right. But at least he's going to remain connected during that time.
Correct.
And I think that's the biggest thing. You have a family member or something that that has struggled, like this year, can you make the eggnog with just the eggnog? It doesn't need brandy.
Yeah.
Can you do without? So I think it's just, be that support.
Yeah, there's some basic tips for the holidays, and of course one of them is staying connected, is being with people, like-minded people, and going to meetings, because meetings are everywhere. During the holidays, you can always hit a meeting. Always make sure that where if you're going to families and they have alcohol being served, make sure there's a family member that you're hanging around with that knows your every move. Okay. And again, that's hard to do. It's kind of admitting that you're weak, whatever. But you know what? There's nothing wrong with it. Let everybody know in your family where you're at. Don't go to a back bathroom. Don't go to a back bedroom. Just be visible. All right. For everybody to see where you're at. One of my things in early recovery was I was always drinking a soda out of the can. Not that I couldn't put alcohol, in a can and never can. Okay. But they knew. And again, it's and if you're not comfortable going to a family member's house, don't stay home by yourself.
Right.
That's the other thing. Make sure there's somebody with you.
Yeah.
And there's plenty of people in recovery that will stay with you. Okay.
Absolutely.
During that time. So it's just try not to get as stressed out. Don't worry about buying, if you're in your first year, don't worry about buying gifts for somebody.
Absolutely. That seems to be the number one thing I'm hearing from people.
It's a big one, because now you've got a year under your belt, or maybe a little less, maybe a little more, but you're thinking, oh shit, I should have more money than this. I should have planned better, whatever it is. No, screw it.
Yeah.
Okay. You know what? Your family would rather see you there alive, well, and healthy, than worrying about a gift from somebody. That's stuff that we have a tendency to put on our own heads, right? But we can beat ourselves up pretty good, about stuff like that. But
if you or a loved one is struggling with addiction, please call PAIN, Parents and Addicts in Need, at 559-579-1551, or visit us online at painnonprofit.org. Follow us on social media on Facebook, Twitter, Instagram, and TikTok at Pain Nonprofit. And please subscribe to the Don't Hide the Scars podcast and share with others wherever you get podcasts and on YouTube. And if you would like to donate to PAIN, Parents and Addicts in Need, please click the link in the description to make your tax-deductible donation today and help us save more lives gripped by addiction.
Yeah,
and that's such a great
things.
point. My
Oh, and by the way, make sure you're eating well. You know, I mean, for me, it's tough to get rid of the cookies and the, you know, and all that stuff. But yeah, you know, again, just be as healthy as you possibly can.
Yeah. Yeah. I wholeheartedly agree. And to reflect back what you were saying, especially about like the family members that love you, you just being there and sober and healthy, like that's more than enough gift. I didn't tell my uncle this until it was over the summer. He hit 28 years. And I said to him, hey, you know, I remember one Christmas when you brought my cousin, his son, who was living with my grandparents at the time, because, you know, he's still getting life on track, a better place for him to be. And you brought him a Sega Genesis and a whole bunch of stuff. And, you know, we were always close. And there for a second, I was like, I had that kid like, well, what about me? And then I realized what you were going through, and to just be able to do that for him and be there for him. And like, I've never forgotten that. Mm-hmm. And, you know, my uncle and I are close but I hadn't reflected upon that. Mm-hmm. Just like, well, yeah, he wasn't there a couple of Christmases, and that really sucked. Mm-hmm. Because to me, he's a laugh, right? You know, yep. former airborne ranger, and you know all these badass things that I dug as a kid, and I could ask him about, and he was just and is such a neat person that it's like, yeah, nothing can replace that, you know. And him actually getting down with my cousin, and I can remember it, and then getting involved and, you know, being there. And mm-hmm. Yeah, what a beautiful thing.
Yeah. No, it is. Getting back to Perry for a second.
Sure.
You know, I didn't see I don't know about you, but I didn't see a whole lot of traction on social media. I mean, I saw a little bit.
Sure.
You know, on his death, but I didn't. I mean, did you?
I saw people posting about his you know, just a rest in peace, or sure. You know, unfortunate, which it is. I mean, every single person that would the 100,000 plus in the states that we're going to lose this year, probably over 110,000. I'm willing to bet. Every single one is a tragedy.
Yeah,
it would have been nice if opportunity there was to prevent every single one, which we know
won't
happen. So I saw some. Mm-hmm. But I think it was, you know, because I run the social media, I really wanted to get out. You had sent it to me, actually, right. You know, like, hey, get this out there, because if there's anything we can do and take from it is those facts. Like, people need to get this. Well, there's such a movement of this long-term harm reduction. This is the consequence that we talk about, that you've educated me on, that I further educate myself on.
It is. And I haven't seen anybody yet talking about the long-term harm reduction piece of this. Not one person except us.
No. I mean, it's stated like in this article, you know, the doctor and how he said it and what it was, but there's no point where anybody goes, in using these substances, which it does state in the article, to help with opioid addiction when it's talking about Suboxone, but there's not a doctor, and heck, I think it's got his contact, I need to reach out to him, that states these are the ramifications.
Yeah. These are the ramifications of long-term harm reduction.
Yeah.
It's exactly what they are.
And you might live until your 70s, but you're going to have the issues.
You're going to have issues.
Yeah.
I mean, you're going to have health issues. There's no doubt about it. You know, I mean, I wonder what the people at dancesafe.org are saying now.
Right.
You know, I'd love to get those assholes in here in a debate on them.
Yeah.
You know, and everybody else that's out there promoting this stuff.
Yeah.
I mean, my God, I don't know. I just. But it just occurred to me that I just haven't seen one person except us talk about this and those ramifications of constantly being on something, especially when, especially a ketamine or a buprenorphine, which is a narcotic.
Yeah.
I mean, we're giving narcotics to narcotic addicts and saying it's okay.
Yeah.
I'm sorry. If somebody's got their degree from Harvard on that one, they need to they need to take it back.
Yeah. What was it? I made the analogy. It's like taking a sex and love addict when they're in recovery and their first job is the DJ at a strip club.
Right?
Yeah.
I mean, come on.
It's it's just not a good idea. Logic on it's gone out the window. And again, I hope a lot of it's ignorance. And I say that not in a demeaning way. Just look up the definition of ignorance, because I was really ignorant till I started working with you. Well, my only defense was I honestly had no opinion because I just didn't know.
Right.
I didn't know anything about it.
Right. Well, okay. That's another one of my points. For all those people out there that are making the decisions on treatment in particular, they're not getting the right information. They're not asking the right people, which we've said over and over and over and over again. And so why? The question is, why aren't they asking? Why don't they want to know about this? When there's Tom Wolfe, myself, Ali Severino, Marcia Stone, Mike Diamond, Dan Carity. I mean, all these people, and there's many more, Mike Fior, right? I mean, all these friends that we know that would be more than willing to march our happy asses into Sacramento or any place else in the country where Marcia's in Texas and Allie's in Florida. I mean, to start to let these people understand what it really means, what long-term harm reduction really means, and what it does, and what the consequences are of it. It's just not about giving a fucking free needle, right? And a fentanyl test strip.
Or straws and foil.
I mean, unbelievable. So I'm just curious why these people don't want to know the real answer. Again, is everybody just so woke that they just don't give a shit?
Do you think it allows people to sit in denial of it? That and we've known some people, and they're very caring, loving people, that, their perspective, which we're not afraid to say, I'm not afraid to say, I know is wrong. That it's just that they're not, that they don't have the ability to see, or that it's the kind of justification, see, I'm doing a lot. Like, I care, and I know you care, especially the people that go out and literally are there working.
You mean giving the needles out and giving the foil out and all that? Yeah.
Yeah, I know that they deeply care, but...
Do they?
But that's what...
Do they care about human life if they're doing that?
That is like my thing, or is it... because I pondered this, like, okay, if I was to go and do, a needle exchange or whatever else it is it because I feel helpless that there's nothing more that I can do? And I just don't, like, I'm hoping that this effort doesn't, that keeps them alive. I've tried to ponder what the morality behind it. Because for me, my issue with long-term harm reduction is a morality one.
Yeah. Yeah. Look, I'm almost to the point where I'm tired of trying to figure out what people think and how they think and why they think it. To me, again, I'm pretty black and white. Facts are facts.
Yeah.
And those that aren't. And people that lie, even if they don't think they're lying, um, bother the shit out of me. It's like when dancesafe.org has a poster, a marketing poster of theirs that has, I don't know, 6 or 7 people on it. And they're happy and smiling and dancing and doing all this shit. And then it says we're addicts. And and they are projecting this lifestyle that they want to project to everybody, that these people are happy and having fun as drug addicts. That's bullshit.
Mm-hmm.
I'd like them to take a picture of all those people in the morning.
Right.
Okay.
At the family gathering.
Right. Or at the end of their daily run when they're out of drugs.
Yeah.
And let's see how happy they are. I mean, so the people that are out there giving this stuff, I just don't understand. Now, the question stands with me on that. Is that a moral failing? And on whose part is the morality failing?
Right.
I would venture to say it's failing on the part, and I'm not trying to be judgmental here, okay? I'm talking about life and death. I'm not talking about judging somebody if they believe in God or they don't believe in God, or they believe in the San Francisco Giants and not the LA Dodgers. I mean, that's not what I'm talking about. I'm talking about the morality of helping somebody to kill themselves.
Yeah.
Or helping somebody to prolong their addiction to where death is inevitable. That's what I'm talking about. That's the moral side that I struggle with the dancesafe.orgs. And who's the other one? The
Drug Alliance?
Drug Alliance, whatever, assholes. Yeah, whoever they are. Anyway, that's what I struggle with.
Yeah. The genuine part of it that bothers me is, I think, or at least it comes across to me that it's a way of looking down on those people that are in.
Oh, sure. I haven't thought of it, but yes.
Yeah. That
oh, poor you.
Yeah.
You're never going to be able to get out of this mess. So here, let us help you, just kind of maintain your addiction.
Yeah. And stop with the safer supply and all that. Like it. How many stories have we had? It was the first time they used cocaine and overdose. Where is any of it safe? Like the word safe
there's no safe drug. It shouldn't be in there at all.
Yeah.
Safe supply. There is no safe supply.
Right. I get the difference between this is pharmaceutical grade fentanyl and this is a pressed pill.
Huh.
But they're both still fentanyl.
Both still aren't safe if used improperly.
Yeah. And the way that they weren't intended, which is under doctor's supervision.
Right.
So that's where it really, it's tough for me, this wording on it, that it's not appropriate. It's not the appropriate wording.
It's not. It is not. I agree with you. So again, a lot of this goes back to the people that are making the decisions on treatment. And it's and again, for everybody listening, it's not the treatment centers. We have our protocols. We know how to get somebody off the drug. I mean, we can get anybody off the drug.
Yeah.
I'm sorry. Give us 30 days. They will be clean and sober. If they don't leave the program, they will be clean and sober at the end of that 30 days. By the way, it's only going to take us 10 days to get them off the drug. In most cases. In most cases. Okay. So now if they're with us for 30, they've got 20 more days before we have to release them out in the wild. All right. And try to get them set up in outpatient and some other programs to continue their sobriety. So by that time, the drugs are out of their system. Physically, they're fine.
Mm-hmm.
Mentally, it's still a struggle. Can be, not always, but it can be. But physically, the drug's out of their system. But because we've got now so many people out there going, you can't do this. Because that's the message that long-term harm reduction people are sending. You can't do this. So let us help you.
Mm-hmm.
What kind of help is that?
Yeah, I agree.
Right? I'm curious to know how long Matthew Perry was clean and sober. And again, I want to say this for the people that I want them to understand what I mean by clean and sober. Clean to me means you are clean off of all drugs, all medical drugs. Sober is being off of alcohol. I'm sorry, clean is both being off. Sober is living that good, productive life.
Right.
Okay. So if you've got 20 days of that already, why would somebody want to tell somebody here, you don't need to be?
Yeah.
Why is there outlets for that to even happen? I know this is kind of pie in the sky thinking, but why are there even outlets for that to happen?
Yeah.
The people and there are people out there right now that they want to, and I can't remember the name of them, damn it. They are perfectly okay with people using whatever drugs they want all day long for all the time.
Yeah. Yeah.
I mean, what a waste.
I asked that in that type of situation, way of thinking, what's in it for you? There has to be something in it for you. I mean,
not by the way they dress, because they haven't spent any money on their clothes. That's for damn.
I mean, that's a little too laissez-faire. Just
Yeah. I mean, what is in it? To get your name out there, like you're helping somebody?
Yeah, because
is that what it is? It could be.
If we don't have as a society a demand of standards, then what do we have?
I couldn't agree more.
I mean, like when we talk with Tom, we've already done it with the totally wrong approach with decriminalization and defund the police and everything else. And we've had too many. The San Francisco when Xi Jinping came and that whole summit and all these other world leaders and how they cleaned it up clearly showed that those that were pushing that rhetoric were quite wrong, because they had to use law enforcement that was on overtime. They put people, granted, they were chain link with the green kind of screen stuff over it, but they put them behind a wall.
Right.
So they created a barrier. So it was an acknowledgement that a barrier can make a difference, not a total difference, but it makes a dent. So it's a lot of these things that are contradictory that all, as you know me, like follow the money. Then who's benefiting off this ideal that's just...
Well, I mean, look, if you want to look off who's benefiting, especially financially, let's take a look at that for a second.
Sure.
All right. San Francisco. We've made this statement before. $569 million budget for mental health and substance abuse clients. They have 57 beds to service over 25,000 practicing addicts in downtown San Francisco. $569 million. Where's the fucking money going?
That's a lot of straws and foil.
You bet. It's a lot of salaries for people. And I'm not against people making salaries. We have to make salaries. We have to eat. We have to earn. We have to do those things. But where's that money really going? Is it being funneled into another project somewhere? Is it going into somebody's pocket? I'm sure both of them, right? And that's all over the country. It's just not in San Francisco. Fresno's budget. Where's the money going? Where's it going in Tulare County, Kings County, Kern County, Stanislaus County, Sacramento County? Where's the money going? Why does it take so many counties and so many treatment centers so long to get licensed so they can service the community's needs? I mean, look, that's what it is.
Yeah.
You know, I mean, it's just like, I mean, this is kind of off base, but it's like the head of the SPCA, the National SPCA. You know how much money this guy makes a year?
Oh, I'm betting like 60, $70 million. No.
No. 1.2 million a year.
Okay.
Okay. But he's head of the SPCA.
Okay. I thought nationally?
Nationally.
Oh, okay.
So
I was thinking it would be more.
No, he's their corporate guy.
Not that I would agree with it, he's
Right.
making more. I just
Right.
figured it's going to be something astronomical.
Right. Now, I don't know if there's incentives or bonuses or whatever for how many dogs they save. I don't know. Fuck, I don't know. Okay. But 1.2, again, I'm not saying we can't make incomes, but $1.2 million a year for an organization that does great stuff, by the way, right? Rescues animals. It's been around forever. They have to pay him incentive what? To stay? I mean, I'm sorry. And then you've got organizations like ours and plenty other ones, okay, that are on the streets every day, on the ground floor of this thing, right? That want to help county facilities, that want to help other organizations, but we can't because we don't have the funding to do it. It just everything's just downside up and upside down, and everything's just kind of ass backwards at this point. Anyway, just kind of my take on some of this stuff.
Well, it's good to have a end of year venting, right?
Yeah, I just vented.
Yeah. Sometimes we have to exercise the demons.
Yes, we do.
Anything else you want to add, Mr. Andersen?
I don't know. Look, it's been an interesting year to say the least. It's been at times it's been rough for everybody. At times we've had some great moments. It's been just wonderful working with you for this last year.
Likewise.
We've done some good stuff. We're going to continue to do some good stuff. I just wish we could do more in this. I wish we could just crack open a few more doors.
Yeah.
And try to get something concrete to help combat this disaster that we're in.
Yeah.
But there's a lot of good people out there. I mean, the Lisa Smitkamps of the world and the I'm not going to mention law enforcement name by names, but our law enforcement people, the Jim Pattersons of the world, the organizations like Breaking the Chains and, these folks that, Fresno is damn lucky. We got some great people here that are working on these issues that, come hell or high water, we're not going to stop. And, we just need a little more, I'll just say it, we need more support from the community at large, and again, not necessarily, I mean, yeah, financially, but not even so much, as we need their voice.
Yeah.
In a lot of this, because in what we do, we all know that this can happen to any family at any point in time. I don't care where you come from, what side of the street you live on, what church you go to, what school you go to. It doesn't make any difference. And so if somebody wants to get involved with us, please reach out. Yeah. We're more than happy to drag you alongside of us. Yeah. And help us get the job done. So.
Yes, sir.
Thanks, buddy. Appreciate it. Appreciate you and everything you've done.
Thank you. And thank you for the continual opportunity because, I know you don't blow your own horn, so I will for you a little bit. I've been honored to be able to be here and see at times the absolute determination at any cost to help someone get treatment and be there for their family. And it being a part of it and you, the leader, I sleep pretty good at night, feeling good about what my life is and what I do, and anything that I do. When we get a nice comment on a posting on social media that resonated with someone or an episode, we've been getting so much more feedback lately. It feels good, and I feel honored that in my clean and sober living that I'm able to be a part of it. So thank you.
Nice, man.
Thank you, good sir.
Appreciate you, buddy.
And thank you guys for, of course, listening or watching on YouTube. If you're on YouTube, hit that subscribe button if it's your first time. Click the thumb up, leave a comment in the episode, and don't forget to hit that bell. I like that sound effect because that's how you know when new content comes out. And of course, if you're on Apple Podcasts, Spotify, leave that rating review. Share with others. We don't do any advertising outside of our own social media for Don't Hide the Scars. So please share with other people and continue to help us grow. And if you want to get involved, as Mr. Andersen was saying, paynonprofit.org. If you or a loved one is struggling with addiction, please call PAIN, Parents and Addicts in Need, at 559-579-1551, or visit us online at paynonprofit.org. Follow us on social media on Facebook, Twitter, Instagram, and TikTok at Pain Nonprofit. And please subscribe to the Don't Hide the Scars podcast and share with others wherever you get podcasts and on YouTube. And if you would like to donate to PAIN, Parents and Addicts in Need, please click the link in the description to make your tax-deductible donation today and help us save more lives gripped by addiction.